that, or
Let me pull up the agenda again.
I'll be right back.
I'm so sorry. I didn't realize that you guys couldn't see me and that you couldn't hear me. Hello, everyone. I heard you say hi earlier. How are you?
I could see your little name on the list, but I couldn't see you.
So now you can. Now you can. I exist. I exist.
And if you have stuff you want us to have, because we don't have a person from the board, or do we have a person from the board that's on the advisory?
I don't
board?
believe so. I was just going to mention that was going to be one of the things I was going to speak on. It would be great to have someone from the board. I could forward you.
We
An
had a
application.
wonderful person for the longest while, but she did her 3 years, and I think you had to kick her off or something.
Which one was that? Maria?
Yeah.
Yes. She actually, you know what? I believe I sent her an application, but I had been sharing stuff. I don't know if you guys are aware. We came up with a Whitmore anthem, and I tried to share it. I don't know if you all got it, but it is the most loveliest thing during this time of COVID that we were able. Our CEO wrote a Woodhall anthem, and I will share it.
What do you have? The hospital staff has to sing it every morning, and then they go to work or something?
It's like the Pledge of Allegiance, right? I pledge of allegiance to the flag. But it's so awesome. It's so awesome. It's like it's one of my biggest things here, and everyone seems to be. It's lifted so many folks in so many ways. COVID has taken a toll on a lot of people. So it's been a wonderful thing. This anthem.
All right. So,
do you want to do attendance now? You don't have a quorum, but
well, we can get going because we're gonna hear from Jessica what's happening at the hospital. Then Jessica, whatever stuff you have, that you send it to Marie and we attach it to our report, and then it goes to the full board.
Okay.
Because normally that was when we had a person on the advisory board, they would come to the meetings and then bring that all back when we met at the office, and then we put it all together. But we're not meeting at the office, and we don't have a person on the advisory board anymore. So,
is there a particular email? Would you like me to send it to a particular email that I can forward you guys, like any kind of events we're having or any kind of our brochures and all the information that you need? I can provide.
You can send it to the board's office, the BK01.
01. Okay. Have you folks been receiving my emails?
Yes.
Okay. Thank you.
Tom?
Yes, ma'am.
Do you want me to do the roll call?
Sure.
Okay. Tom Burrows?
Here.
Gina Argento?
Here.
Bogdan Bakarowski?
Here.
Lisa Bamonte? Lisa? Gina Barros?
Here.
Teresa Cianciata? Giovanni D'Amato?
Here.
Erin Drinkwater?
Here.
Arthur Dibinowski? Not present. Moish Indig? Not present. Rosanna Kaminsky? Rosanna? She was here. I don't know where she is now. Avram Katz? Yoel Landau? Marie Lienza? Yoel Lowe? Dana Rockland? Who is that? Oh, Dana. Okay, she's here. Maria Vieira.
Present.
Okay. All right, Tom.
Yay. Good evening,
Make sure, Tom,
everybody.
you heard me, right, Gina Argento?
At the beginning, yes.
All right, just want to make sure.
Yeah, and your
Thank you.
your names are all on the list too. So
Okay.
I don't know if this is this being recorded, Marie, or not?
Yes.
Okay, great. Hi, everybody. I think this is our second virtual meeting like this. It's a struggle to throw together. You all got the agenda. We had Jessica Rocha, who's the new community affairs person. Well, she's been there a while now, has been wanting to speak to us about what's happening at Woodhull. We always want to get an update from our police precinct. So Captain Fay's here. I don't know if somebody's coming from the 9-4. And then there's been a lot of discussion about homeless issues, particularly what's going on under the BQE. And then I think Marie raised the issue of what's happening with senior centers, whether they're reopening or not. But that wasn't on our agenda, but we can add that as new business. Forget who, I think that might have been, who raised that issue? Who sent that email to me? Somebody did. Anyway, but Mr. Orocho's here. So Jessica, do you want to give us what's happening at the hospital? What things we might need to help you with? Any stuff we should be aware of as the community board?
Yes. So hello, everyone. How are you? So we are resuming normalcy, and things are almost back to normal. The volume's less than normal to ensure the social distancing. Masks are required for all in the building. COVID-19 screening questionnaire for all entering the building. That includes staff, visitors, and patients. They're also temperature checked. Visitation restricted to 4 hours per day. So that would be from 3 to 7 p.m. One visitor per patient at a time, and visit is limited to an hour. Surgeries clinics are fully back in operation, and they're also doing in person as well as televisits. Surgeries are back to normal, elective, urgent, and emergent. The ER volume is increasing as patients are returning to the hospital. COVID-19 testing is being provided to the community, the antibody and the flu shots. There are no significant increases in COVID patients with the surges in Williamsburg. We've also had several events that have taken place, such as the poetry and art exhibit have taken place, where we had community folks, artists provided art pieces, and I had another sponsor that placed them on canvas. We have them on the Marcus Garvey side, beautifying the building. As you know, the facade of Woodhull is not very pretty, right? So we're trying to do a lot of things. I have been trying to work very collaboratively with community in trying to help with the beautification of this building, right? There's not much we can do, but we have art on canvas on the Marcus Garvey side going around the building, and it's lovely art pieces from community folks. We had the I Love My Artist Foundation come here, and they played music. It was a band. They played music. We had all the elected officials come out. That was on October 2nd. We had our mural, a mural on the front of Woodhull Hospital, a lovely mural. I can share a picture with you guys as well. The mural is in front of the hospital, right in front of the bus stop on Flushing. 12 feet long, about 8 feet tall. It is beautiful. Please come by and check it out. We had a paint party. The visionaries of this mural, we included community, our CAB, which is our Community Advisory Board. We had their opinions and their ideas, as well as staff ideas, and that was all of it incorporated through an artist by the name of Imani. She made our words and our visions come to life, and it is such a lovely piece. I want to show you really quickly. This is what it looks like. Right down here, it says Woodhull Heals. I don't know if you guys could see it really well, but it shows community. It shows community at large. It is beautiful.
Yeah, it looks pretty, I can see it pretty well. Did anybody from the committee get a chance to go to the unveiling? I didn't get a chance to go.
Maria Vieira was there.
Okay, great. She loves the hospital, that Maria.
It does. I tell you, I am so grateful to all the boards. You folks, we need boards. We need boards, and I want to be as active as I can be to ensure that I get the information and I provide you guys with the information. So anything that I can do or anything that I could be of service with, please let me know. I am new. I did start in February, so this is all new for me.
We had a member of your community advisory board for a while, but then we haven't had one since the beginning of the year, I think.
Yes. That's
So was there a term limit for people on it?
Yes, it's 6 years. It's 2 years. It's 3 consecutive 2 years, so it's 6 years.
So I think that was our problem. So anybody on the committee who's interested, I don't know, can you send us the information about what that entails? If there's a descriptive about, so we can get maybe somebody on the board other than, because there's a person from the board who's been sitting on the advisory board, but not as the board's person.
Okay, so I can send it to the BK01 email.
Right.
The application is very self-explanatory. One of the things is that they'd have to go through a screening. We'd have to screen them, background check, and they would have to do a physical or something like a regular physical.
And the CAB meets once a month or every other month, or?
It's once a month, the third Monday of the month, and it starts at 6 p.m. 6 p.m. and
It's an evening meeting. Okay.
Yes.
For some reason, I imagine it was a daytime meeting, and people work for a living; they can't really go. So, but
No,
put that all in whatever kind of packet, and then I can sort of see if anybody on the committee is interested. If anybody jumping up and down, waving their hand, interested in doing it, let me know. They're also quiet.
You guys are all welcome. Whoever would like to come, if anyone would like to just show up and just share information, it's always wonderful. I futuristically I will be planning to do an informatory day, inviting all kinds of community-based organizations, precincts, all kinds of collaboratives, so folks can share information, introduce themselves, so that we can build more of a connection.
Is the CAB virtual right now, or is it meeting in the boardroom?
We have half and half. So some folks come in. Our conference rooms are beautiful. They're lovely. And I want to extend our space to you as a community advisor, as a community board. You folks are more than welcome to hold meetings here if I have availability. We have 4 beautiful conference rooms. We also have a beautiful solarium and auditorium, but our solarium's not it's not ready yet because we have beds there. But if you guys need to use our space, we have a beautiful new updated WebEx system, and it is important that as a community person that I make this available to our community boards. And I want you to know, I would make it as easy as possible. I would work around everything that's happening here to provide you with a space. You can come and check it out. It is lovely. It is lovely and it's spacious. So we do have half and half. We're entitled to have in the room about 20 people that at a social distance. So just keep that in mind. There's a lot of space. And when you come in, you're on the opposite side of where the patients are. And then we also do virtual for those people that cannot attend physically or are afraid. You have the option of being here or doing it virtually.
When is the next CAB meeting, in case we get somebody who's interested?
It's upcoming Monday.
Oh, this Monday. Oh.
That would be Monday, the 26th. The 26th.
All right. That's
So
soon.
I have been invited to come back as a CAB member,
Yes,
Really?
you have.
not in the capacity of representation of Community Board 1. I think just as a member of the community. Is that correct, Jessica?
Listen, we wanted you back either way, because you brought back so much substance. I mean, you played such a major role in the cab, and everyone was like, "Well, what's happening with Maria Vieira?" Right? So if you want you back at whatever capacity it is, it would be great if you could come in representation of the board.
I think that I
as
would
long as
like
we
to
have
pass
you.
that baton. I'd like to pass that baton to someone else so they could also, have that opportunity, someone else from the board. But
If you could
I'll join. I think I'm gonna, I was looking at the application. I will submit it as a resident. But if no one else from the board wants to, take it on, I guess I will. But I would like it if someone from CB1, someone other than me would take it on in representation of the board.
All right, well, so we have to recruit, Marie. We have to recruit somebody.
Yeah.
You and I
It's
will
a
have to
great
be a recruiting team.
experience. It's a great experience. And to be honest with you, the food is great.
Maria, are you filling the spot of that other person from the community?
No, of a person, not a community board person, just a community
No, but there
resident.
was another person from our community board who was not on it from the community board.
That person is still there
Oh,
as a
okay.
member of the community.
Representing
as I
himself,
understand it.
representing Cooper Park, representing.
I don't know, maybe Jessica can say. Jessica, he's talking about Tommy Torres.
Well, Tommy does bring up things from the community board, but I believe he's representing just the community. We don't have him as part of the community board, but he does like report things that you guys speak about. He'll mention things. I don't believe that he is not he's not there as a community.
No,
board.
we know that, but we're just wondering who he is representing. That's all. I mean, like, do you just let anybody join as a resident until you have
If they're residents, if they use the hospital, but because he's also a part of Grand Street campus, which is a high school nearby, is also good because we have a collaboration with the high schools where we in the past we had a medical facility inside providing the flu shots, the vaccinations, but now we have them come directly here. So that's how he's representing there.
So all the schools can utilize the hospital for, I mean, is there like a direct connection with all the schools in CEC 14?
Well, we have the central office has said like teachers, students, we have to they get a higher priority. If they're coming here for shots or for COVID testing, we have to pass them through. So we have to skip folks online because they have it's school.
Gio, are you aware of that?
Yeah, we've been going. Staff members been going to go get the COVID test. I'm actually going to go on Saturday to get a COVID swab.
Okay. All right. Well, we'll need to recruit another person, Maria. So that'll be our project.
But if you send the application, depending on what the commitment is, I can make myself available to participate.
Thank you. That makes me happy.
Does anybody have any questions for Jessica or comments or want to talk about the mural if they went to see it or anything like that?
I have a question, Tom.
Sure.
That's a direct hit. I'm the only one that went, Tom. That's
Go for it, Dana.
Hi, Jessica. So my question is maybe more general, but really is talking about the moment that we're in right now. And this is the Public Safety Committee. And so the whole country is talking about what is public safety and how is that best achieved. And I think many people believe that it has to be holistic and address various issues in the community by leveraging partners in a really innovative way that we haven't before. So given what's going on in the world with the Black Lives Matter movement and racial equity and a reduction from over-reliance on policing, how has Woodhull changed either the way that they do business or increased the way they've done business so that they could best assist those that might unfortunately come into contact with the law when they really should be coming in contact with medical professionals?
Well, to be quite frank with you, Woodhull we have a great communication with the precincts, right? So with all the precincts, 907983, they're here helping us out all the time. So anything we need them for, they're here. Community, the Black Lives Matter hasn't, so I can't say it's really affected us as a hospital. We've continued providing services. We haven't had any real issues that have derived here at the hospital.
I think maybe you're misunderstanding the question. So my
Yeah.
question really isn't your relationship with the precincts. We understand that those commanders are very personable and reach out to you and you have a good relationship with community affairs. My question is, how are you servicing the people in the community that either maybe experience gun violence, people that might need mental health treatment, all the addiction special? How are you doing strategic outreach to those people so that lessens the need for traditional law enforcement interventions?
At the moment, we have our psych unit, the fifth floor. They have a beautiful outreach system. They've been doing a lot of tabling outside in front of the hospital, because we have a lot of folks. I don't know if any of you folks have passed by the hospital. Ooh, what happened here? I don't know if any of you folks have passed by recently, but we have been, can you see me now? We have a large amount of folks around the hospital that are homeless, are mentally disturbed. So to tell you the truth, we've been able, with the tabling, we've been able to reach out to that community and we've been helping folks. We also have,
Are there measurable outcomes for the folks that you're helping? And what is that relationship like with DHS, where we could see folks that go from homeless to maybe transitional care? Like, how do you measure that you are a city hospital getting city funds, right?
You know what? Yes, we would be. That's a great question, right? I do know we have a collaboration with the building that was built right behind us, and that's with Ms. Gill, Rosa Gill. So we've gotten a lot of patients to be placed. That's a facility, a living facility for folks having mental problems. But we have a great collaboration with them, and they've taken a lot of our patients. But Dr. Lilu is the doctor who's in charge of that. And for the next meeting, I could definitely have them get online because they're the mental health component. They could definitely help you and answer your question better.
So can I just jump in here for a minute, Jessica?
Yes.
I think it would also be good to invite Dr. Fishkin. Dr. Fishkin is a numbers person, is a stats person. He's ready to spit these numbers out off the cuff in a heartbeat. That's one thing. The other thing is that what you were mentioning is the supportive housing development that was built on the parking lot of the Woodhull campus.
That's correct.
There is a connection with an organization, and I forget Dr. Gill's, what is the organization? She's the CEO.
I was gonna call it Riseboro, and I'm like, no, that's
It's
your
not
program. I'm
Riseboro.
sorry.
It's not Riseboro, unfortunately. No. So I know that Woodhull partners with that organization. I know as well that there are social workers on staff. It is a mental health facility as well. So there is a holistic approach to the social determinants of health. I can't speak on behalf of Woodhull. I can only speak as a community advisory board ex-member trying to be a member again, and having been privy to the conversations that take place at the table. I know that they are always taught, there's always discussion about collaboration. There's always discussion about addressing these issues. And when you talk about racial equity, well, the majority of the patients that are served at Woodhull are people of color. If Woodhull at this point doesn't know how to address these issues, I really don't know.
Well, Maria, I think
We're in trouble.
Wait,
Let me
Excuse me. Where are we going with this?
I'm just saying that there should be somebody from Woodhull, like Dr.
Yes.
Fishkin, that can talk about stats, and perhaps even Mr. Kalist, who is the CEO, that can come and answer a lot of these questions. These are really good questions that Dana's asking, but they should be posed to the people that are involved in that type of activity.
And Jessica,
Let me
the
just
other thing
interject
is,
here. The
wait.
name of the organization is Communal Life.
Communal life, that's
Yes,
correct.
communal life.
Jessica, where did you go?
Right here.
Okay. Jessica, the other thing is, COVID's now been with us. We're up to 5 months of staying at home, and people are they are anxious, they are nervous. There's increase in the domestic violence because people are staying home with people they don't want to be staying home with. My teenagers don't want to be staying home, but they're being forced to stay home. So somebody from the mental health part who can talk about psych interventions to try and prevent people from doing things that results in the police being involved. That mental health intervenes, the hospital intervenes to address the problems before it gets to be that somebody does something that the police have to be called for. Because my boys, for example, are tired of talking to therapists on a screen 1 hour a week. They're like, when can I see somebody? Families that are living together that are starting to get on each other's. So is the hospital doing something about that? Is a hospital intervening so that the police don't have to intervene? That's probably what we're talking about. Yes, Dana?
Yes.
Exactly. It's reimagining the public safety conversation so that we could utilize the services you have to work best to lessen the need for traditional law enforcement.
Well, thank you, Dina. You raised some really valid points that I really, I don't specialize in those areas, although I am in these meetings, right? One of the things that I do say, I don't speak your language. Can you bring it down one notch, please? Like, can you talk to me in my language? I just started learning all the acronyms. They said ILI, and I'm writing down ILI and Googling what is ILI. Influenza-like illnesses. So now I have a whole book of acronyms, So this is all a learning experience, right? And I would definitely love to get Dr. Lidu, who's in charge of the psych area, right? So, and speak about intervention plans, right? And Dr. Fishkin, who is the man of numbers as well. Dr. Fishkin has been well known in the community, very active in the community. So I can, for the next meeting, if you send me the information, I can get both of them together.
And then the other thing is adolescent psych, because there's a lot of trauma around when people haven't gotten intervention, they react, and then there's violence, and then there's trauma for the people around them. Does the hospital, when it sees somebody in their emergency room who's been the victim of a seriously violent crime, have a way to then connect with the family and friends to get them counseling so they don't respond inappropriately and get themselves arrested? Sort of like the violence interrupters, the hospital violence interrupter working with the community violence interrupter to prevent, because everybody wants to go out and do revenge, but if somebody intervenes and gets them some kind of services, we can prevent some of that perhaps. And I don't know if the hospital is geared around that or not. Right, Dana? Muted, you're muted. I see your lips. I see your lips.
I think, if I'm not mistaken, I think that Bed-Stuy SOS and Los Suras have hospital responders, but I'm not 100% sure about that. I mean, that's another thing, Jessica, is we're seeing an uptick in gun violence, making sure that, we're addressing the trauma of that in a holistic way is really important.
Okay. Sounds like a plan for another meeting.
So that would be, you want me to get information on adolescent psych to prevent issues, right? So that would be one, what would they be doing in reference to adolescent psych, help to prevent issues and interventions for community. Is that correct?
Yeah, we can fill
Jessica,
you
maybe
in.
Dr. Urkullo. He's the head of the site, right? And
No, it's Dr. Lilu.
Dr. Lilu now? Okay.
Yes.
I got to get back in the loop.
All right, anybody else have any queries for Ms. Arocho? Committee? Anyone? Jessica, thank you very much.
Thank you.
We'll have to figure out when our next meeting is and then coordinate, having some people talk about this. And if you've got questions about what we're talking about, Dana's always available. I'm always available. I work with 15 to 18-year-olds in the family court every day, seeing what their responses. And Dana's working with those young people too. So feel free to say, what were you talking about? Or have that person say, what?
Okay, that's great. Thank you so much. Thank you.
All right. Captain Faye is here, and I'm sure she wants to go back to work. So perhaps we can move on to what's happening in the 9-0.
9-4.
9-4. Lost my mind. I've been home for too many days. What a great picture you have, Captain Faye. Nice. Turn your radio.
I can't. Can turn it down.
Tom,
Yes.
there's someone in the attendee who had a question, but she did not put it in the chat.
Oh, how do you know that?
I see there's a question mark next to her name.
Oh, because I'm looking at the attendee list and I'm not seeing that. I'm just seeing
Sarah,
little
yes,
microphones.
Sarah Hickman.
Oh, okay. Does she have a question for the hospital?
It's the Q's and A's, Tom.
I know, but did she have a question for the hospital? Can we turn her
When
on
is
so
the
she can
next
ask
meeting?
it?
She said, when is the next meeting?
Oh, we don't know yet. We had a hard enough time setting up this one, but we'll work on it. I see. I got the Q&A open now. Okay. Ms. Sarah, we need to work on making the next meeting. This one was a challenge, and we'll figure it out. We'll let everybody know. Okay? All right. Captain Faye.
Yes.
What's happened in the 9-4?
So,
And then you can throw in there your relationship to the hospital if you want, and then anything about the homeless concerns.
So basically, the 9-4 is experiencing an increase in major crime. The week to date is a 37% increase, 22 versus 16. For the 28-day, we see a 53% increase, 106 major crimes versus 69 in 2019. And year to date, we're seeing a 21% increase, 780 crimes versus 643. Commercial burgs continue to be a big problem for the precinct. We had 4 Saturday evening into Sunday. Most of them were on the first platoon. There were 2 on Franklin Street, 1 on Driggs, and 1 on North 9th. This is part of a pattern. It's a citywide pattern where they're breaking the storefronts with hammers or bricks and basically grabbing cash registers or cash. In one case, they took clothing from the clothing store. So this continues to be a problem. It's driven mostly by the fact that we have a cast of characters that keep getting released on bail, without bail, and then the ones that where bail is set, the bail is so low that they have no trouble making it, so they're back out again. So basically, between the burglaries and the grand larcenies, that's really the GLAs, the stolen cars and motorcycles. That's pretty much what's driving our major crime right now. Quality of life issues are absolutely, we're getting a lot of complaints about them, but at this point, there's not a lot that the police department can do about them.
The burglaries, is that the ones where some of our bars and restaurants have had their doors kicked in and the people are taking all the alcohol and the cash register? Is that part of that?
Yeah, we had liquor stolen and different things, but just to put it into a little bit better perspective, in all of 2019, there were 108 burgs throughout the precinct. So far, year to date, we've had 193. So 112 of them were between June 1st and October 1st. So, you know, there's obviously a lot of things going on, but I don't think that all parts of the criminal justice system are firing on all cylinders, so to speak. You know, I'll give you an example. We identified a person that we saw on social media that was seen holding a gun. He's somebody that has a lengthy criminal history. He's out on probation. When we reached out to the probation officer, they basically said, well, we're not going to go visit him. So this is an individual, if he decides to kill somebody, you know, we've made the notifications and other parts of the criminal justice system aren't coming across.
Okay. How's parties underneath the bridge? Is that yours or not?
At the Kosciuszko, yes. So
Yes.
we did have that rave. This is going months back. Once the state came in and they gated it, I also had a car under there assigned for about 2 months, which kind of, we weren't seeing the crowds like we were seeing before that. We still have various car meetups that take place in the command. Just last night, we had a shots fired job at 198 North 4th. It appears it's probably an illegal venue that's hosting parties. We're looking into it. There was a party that was in the club. We did not, it wasn't a confirmed shots fired job, but there were a few females that were cut up, whether it was broken bottles in the establishment, but we're looking into that because there was liquor in there. And we're just getting more information at this point as to who's responsible for the building. There's certainly no signage that would indicate it's a venue. So I'm sure there's things there that need to be addressed.
Marie, can you turn Lisa on? She's in the attendees and not the participants.
I did. I pulled her. I pulled
No,
her out. How'd she get back
Okay.
there?
She's in the attendees. I don't know how that happened.
I pulled her out. I don't see her. Right? She's there again. She's back in the.
There, no, she's back as a
I'm
presenter.
unmuted.
Okay, there she is. There she is. She's a presenter now. Okay, Lisa, do you have anything to ask of Captain Fahey?
So everyone knows that we were burglarized at the restaurant. So is this the same person?
It's a whole First of all, what is complicating the investigations are the fact that everyone has masks and gloves on, and you know, when you couple that with a lot of them wearing baseball hats, it's almost impossible to get any type of you know, decent ID. You know, even when we think we have an identifiable piece of clothing, the DA's offices won't take that. They won't prosecute just based on sneakers or, you know, we got them wearing the same clothes that they had in one of the wanted flyers. So it's not just one person. It definitely is. For instance, recently there was like a trio of people that were arrested. They all actually were sharing an apartment in the 90. They did a search warrant over there and found a whole host of things, you know, baby clothes, bikes, things that they're doing, whether they're package burglaries or they're doing more of these commercial burglaries. So we have a very long list of identified recidivists. And, you know, when these people do hit, we kind of have an idea of where to look. But, you know, even as far as the investigation goes, the DNA, the lab is completely backed up. We just got things that we submitted in February, just came in last week. You know, this is so when the evidence collection does come and tries to get DNA or fingerprints off of anything, the turnaround time is abysmal. You're talking, you know, this is at least 6-7 months before we got things that we submitted back in February.
Right. Okay.
Any issues or concerns with any of the street closings or the restaurants in the street or traffic issues that we should be aware of?
I met with Noel Hidalgo and Elizabeth Adams, people that kind of were taking stewardship of Berry Street and Driggs. I know there were issues with the barriers. You know, I've met with several people. I would like to get all parties in one place because just as many people that are for it are against it. And, you know, from my position, the police department's role is really just to serve the community. However, they really want this program rolled out. So you have a group of people that don't want any cars and they want the streets shut permanently. And then I've heard from just as many residents that say, you know, there's bad actors that leave the barriers up way past the 8 o'clock time. You know, we certainly experienced that where we're called to places repeatedly. You know, and with the rise in crime, I really don't have the resources to be babysitting people and taking barriers down, you know, repeatedly. So my concern, which I've expressed it numerous times, is, you know, the way this was supposed to be rolled out, it was a soft closure to permit vehicles through traffic at 5 miles an hour, people that live on the street, local deliveries, emergency vehicles. What we do see are people completely blocking the streets. So, you know, you get a stretch like Berry where an emergency vehicle, an ambulance or a fire truck, they're having to get out at every single corner, which is, you know, precious seconds that somebody may not have. So to, you know, the extent that when we see that, my officers have been instructed to correct it. But you certainly have people in the community that feel they should be completely closed and they take it upon themselves to do that.
So so there's the open streets for just the street being closed, but then there's the streets where the restaurants are in the street, like Graham Avenue for 1 block, for example. Are they supposed to be allowing traffic through that block, or is that fully closed for the time of I don't know if you know specifically or not.
Yeah, so that's it really, I guess, is more in the 9-0 than.
Well, no, it's on your side of the Metropolitan. It's just like 2 blocks in.
So we haven't had any complaints over there. I did, you know, you may know when they wanted to close Manhattan Avenue from, I guess, Nassau to Driggs, maybe, wherever they wanted to close it, I weighed in and I just said for traffic reasons, and I didn't think that that was the smartest move. So, you know, we have these roadside stands that are already able to function. I didn't see the benefit of closing it. And in fact, you know, we get tons of complaints. We did early on about Berry Street and all the music and the crowds that this attracts. So there certainly are concerns all around.
But but it sounds like you're saying that Berry Street is supposed to be open for vehicles going 5 miles an hour and local deliveries and stuff.
Yes, the open streets program, that other, the roadway dining is something separate.
So you have like 3 different forms of street closing you're trying to deal with.
And then they added the schools, like Eckford is supposed to be able to close so that they could have students outside. I haven't seen that in effect, even though they were given permission. And we were told that the schools will fully maintain that and be responsible for that.
Okay, I'll have to talk to the transportation committee and see what the various blocks. You have a color-coded map now of what kind of block is closed, what kind of way is it?
It's kind of died down. I mean, it was a lot more. I think everyone's kind of getting used to that. So the complaints aren't as frequent as they were when this was newer.
Anybody on the committee have any questions or things to raise with Captain Fahey? Turn your mic on and speak.
Question.
Dana?
Hi, Captain.
Hi.
Nice to see you.
How are you, Dana?
Even virtually. So just points of clarification as far as the being up exponentially in crime. When we talk about the 7 majors, are you saying we're just up in Bergs and the GLAs, or are there other categories that are up as well?
So year to date, we're up 2 rapes, 9 versus 7. We're up 6 robberies, 60 versus 54. We're up 1 felony assault, 77 versus 76. The Bergs were up 193 versus 79, which I spoke about. And the GLA is 110 versus 82.
And are the GLAs part of a citywide pattern as well?
We're like citywide, everybody, it's, let me just get you the citywide numbers. Citywide, they're up 63.3% in GLAs. So all the categories that I'm up in, we're seeing a citywide increase and a borough-wide increase. It's not just the 9-4.
Okay.
And just to be, also to confirm, so we don't have people getting really paranoid here, unless you think that we should be. When you talk about shots fired, that means that a shot spotter was activated, but you were not able to recover any shell casings and no proof that there was an actual weapon fired.
So the 9.4 doesn't have a shots spotter. It's in the 9.0. So,
Okay.
you know, when we get shots fired calls, you know, we kind of have to get there and investigate as quickly as possible. What makes me uncomfortable is that this was an indoor thing. There's bouncers involved. There's people that could have swept up if any shell casings. We didn't find anybody that was shot. So we did have witnesses saying, well, they were shooting the back. It wasn't all adding up. You know, you had people that were drinking alcohol. So when they said they shot through the back windows, this location has no back windows. So, you know, the investigation didn't show that there were any shots fired. There certainly seemed to be some, whether it was a scuffle amongst the people that were inside or a bottle fell and they thought it was a shots fired and now they started running and people fell. But we did have 2 individuals that were cut, you know, from glass, we presume. So, you know, that's just a location that I want to keep a closer eye on because it's, you know, especially if they're not operating as a legitimate venue, which we shouldn't be having any crowds anyway.
Right.
You know, we'd want to get more attention on that.
And then the last question I have is, you know, is DHS or Breaking Ground or any of these so-called community partners, have they increased their outreach? Have they come to you to come up with a strategic plan to address the quality of life stuff that we're seeing as being problematic here in the 9-4?
I'm going to be honest with you. We have had no contact whatsoever. There's actually, you know, the city council voted to take a lot of the responsibilities away from the police department. And, you know, in my opinion, there hasn't been any replacement. So we're fielding all of the complaints with, you know, none of the resources, you know. So basically, you know, to give you a frame of reference, when I got here at the end of December, in January, February, March, we, you know, in partnership with these other organizations, you know, we were conducting pretty much weekly cleanups under the BQE. Now we basically, you know, call it in as we get the complaints, and we haven't had any, you know, interaction. To my knowledge, they may have come out and done a cleanup, but certainly the precinct hasn't been tasked with going, and I don't think the community feels that they're satisfied. We're getting a lot of complaints, and you know, I met with the new chief of sanitation. You know, we went over some concerns, even as far as some of these buildings outside, holding them responsible, who we can give summonses to. You know, so we're trying to work together, but it certainly isn't on the part of sanitation either. You know, we met here in my office, and you know, I think we're on the same page. So we're happy, you know, to conduct these cleanups. I don't know if it's issue for them.
Yeah, no, I think what we have to do, Tom, as a committee, is that we have to hold Breaking Ground and DHS responsible. They have a budget. They have jobs.
All right.
They don't need.
I got it. I know that. And there's a committee of 12 people. And I keep saying somebody own this and put a list together of who we have to drag into a room and slap around. But, you know.
It's a shame because they have huge budgets and they're charged with getting this done. And so,
because it used to be we'd call up Lentil's office and Lentil's staff would get the state DOT and then we'd get city DOT and then sanitation and the police department. And I guess it was the health department all would show up. But it was coordinated by the police precinct to make sure everybody was there at the same time because they were providing the security so that health department.
Well, that's part of the collaborative policing model, I think.
Right, so the city council told them they can't do any homeless outreach anymore.
What they can do is what they're doing is what Captain Fahey is doing, which is alerting them to the problem. Now they have to activate and
right, but we used to be able to. The precinct used to just say, "Okay, everybody, this is when we're going to have somebody out there to be with you. Everybody show up, and we'll make sure you're all safe."
Well,
they can't do that
police
anymore.
don't need to be babysitters of organizations that have mandates and budgets.
No, but there has to be some agency that gets them all to show up together at the same time. There doesn't seem to be a place that you can say, okay, get all these city agencies all to show up together, because commissioners aren't going to tell commissioners what to do. The police department used to be able to do that. We don't have that. That's the problem right now. You know, Ben calls up somebody and Jennifer calls up somebody, and then they show up at different times and it doesn't get coordinated. Before March, Captain Fahey could just say, okay, I'm going to have a car out there at 10 o'clock on Thursday morning. All the rest of you show up. And then they would, you know, show up.
Well, we can't, well, we have to hold everybody accountable. It's not up to the police department to do that stuff. So
Right.
let's creatively, and, you know, if Ben's on the call or if somebody, you know, let's creatively think about how to create a task force that actually is functioning and does the work that they are getting paid to do. Like that is my point. They have budgets, they have staff, they have vehicles, they're being paid, they should be doing it without Captain Fahey expending resources or babysitting them.
Right. Well, we invited sanitation to come to tonight's meeting. We invited Yuri Sanchez to come to tonight's meeting. We invited the health department to come to the meeting. So we're getting to that agenda item next. So. But Captain, anything for the precinct specifically? Anybody's got any specific issues? Captain Fahey, you're doing virtual community council meetings?
Yeah, we had our second one on October 7th, and give me 1 second. The next one it'll be Wednesday the 4th, November 4th. It's scheduled for November 4th. I'll send you the link as soon as
Yeah, well, usually I get those emails from Betty, but I don't know how
we were
what happened.
putting it on our social media. I don't know. She was supposed to send it out to her email list as well.
Yeah, so I must have missed that one. Okay, so you're doing the first Wednesday? Second Wednesday? First Wednesday, okay.
Second Wednesday is Veterans Day, so let me just verify before.
Well, second Wednesday used to always was the 9/0. You did the first Wednesday, the 9/0 did the second Wednesday. That was the deal you guys had. So the 4th is the first Wednesday, so that sounds right. All right, anybody on the committee, if there's police issues, you should go to the community council meetings. It's a great opportunity to get the captain's ear, and then she assigns somebody to speak to you about what your issue is, and it gets handled. So if you have people that you know in the community, the same thing. They can sign on and go to the community council meetings. They're very responsive. So the captain sort of like points to some police officer standing in the room and say, would you talk to that person? And then it gets done. So anybody out there, any questions? Kath, let's see. Maria?
No, I don't have a question. I'm reading the questions and answer and in the chat.
Oh, okay.
So there's a person.
Thank you for monitoring the chat. I have no idea.
There's a person by the name of Taryn Atherton who's asking, when are you opening Barry? And she says, I hope you keep it closed, or I'm sorry if it's.
That's not, that's up to City Hall. We have that's their open streets, and I believe they're continuing that.
Okay, thank you. And John Hanrahan, I hope I'm not butchering your name, John. Captain Fahey, can you please provide any specific data connecting those bail-related phenomena with crimes in the 9-4?
So we have one individual, he was part of a citywide pattern. He's out. I know that we dropped at least 20 numbers into that citywide pattern that we felt that he was most likely responsible for. They wound up, the grand larceny division wound up arresting him. They dropped 2 numbers on him out of all the numbers. He was in on $15,000 bail. He made it. He made the bail. He's out. And I just spoke to the CO of the A3. They had him driving around in a car. He, ran lights when they went to pull him over. They ditched the car, the car had hit on our license plate reader in the 9-4, right about the times that we had those burglaries on Franklin Street. And they found the car abandoned with a police scanner that was tuned to the 104. So, this is somebody that before bail reform, he wouldn't be out to strike again. So, you know, this is a conversation obviously above my pay grade that has to be had with the district attorney's office. But district attorneys are elected officials that, you know, presumably are going to be responsive to what the community's needs and wants are. So, you know, if the community feels it's okay to have people out that are going to go out and burglarize people's homes, you know, that's what we're seeing right now. You know, I can prepare a more in-depth analysis of all the people that we've arrested multiple times this year for burglaries, but it has to, you know, off the top of my head, I can think of at least 3 or 4.
Okay. And then we should get Jonathan involved and somebody from the DA's office to perhaps respond to how we could make sure that there's some way to address that.
And I just want to be clear, you know, we have a very good relationship with the Gray Zone. Danielle Eady's the bureau chief. I reach out to her directly, especially when it's somebody that, you know, we really feel strongly like they should not, you know, bail should be requested. But, you know, we're averaging that for them to ask for bail, they need to be arrested 7 to 10 times. So, you know, when you take a look at those statistics, that's 7 to 10 victims that, you know, wind up having to bear the brunt of that.
Okay. Thank you. Anything else in there, Maria?
No, the next thing is about, it's a question, but it's the topic of the next
Okay.
topic on the agenda. It's so to hold DHS accountable. It's
Okay.
just a comment, Sarah Hickman.
All right. Thank you, Captain Fay. I understand the 9-0 is all tied up in dealing with the 10,000 person wedding.
Yes.
So I'm sure the
Oh, thank
community
God.
affairs people and the captain and the XO and everybody are addressing that tonight. So I spoke to Kenny earlier and said, if there's stuff you need to let us know, we get that to the board afterwards. But that's where they're all focused right now. So, okay. Thank you, Captain Fay. You know where to find us, right?
Yes. If you
Okay.
need, let me know. You want me to stay on or you're
If you'd
good?
like, because we're going to go into the homeless concerns issue. And I think I would like to have Gio, who talks about this, to, you know, alerts us to various things that he observes, perhaps bring up the topic so we can talk about it and see what it is we want to do as a board. Can you do that, Gio?
Yeah, I'm here.
Okay.
Okay. So, basically you know, it is an issue. They start off at, Meeker and Kingsland. They have like mini encampments, and then the larger encampment obviously is by the, what is that, Humboldt Street and, Meeker, where, you know, where the gas station is, so that they panhandle and right off the ramp of
All right.
the
So
highway.
first of all, Gio, I never leave my apartment. So
Okay.
you need to identify the location so then we can get somebody to go take care of them. So
Okay,
you're
yeah,
talking
so
about,
it's Humboldt and Meeker, right? McGinnis and Meeker, obviously. You got Kingsland and Meeker. I've identified these locations 100 times, but you know, I'll do it again. And then North 6th and Meeker, that's where they have another group of you know, drifters that are, you know, doing their drugs and have their little encampments. And my concern is that they are using needles and they're leaving the needles behind. My students come from, you know, where the G train is, they walk under the highway to come to the school, which is on North 6th. And I'm waiting for the day for there to be, Sarah, I understand that they're people too, and I'm not complaining. I want them to get services. All right. That's why we're bringing this up.
wait,
All right.
we're not doing cross. Well, let's just identify the
So
locations.
those are the locations right now. North 6th and Meeker. You have a couple of panhandlers. You have McGinnis and Meeker, right by the gas station. And you have Kingsland and Meeker. And then you have whatever that block is after Kingsland, heading towards the ramp of the highway.
Okay. So we have some sorts of encampments, I believe,
Yes.
of furniture and things like that.
Yep.
We have people who are approaching vehicles, I assume, at the various locations.
And they use
then
dogs.
there's
They
the
use
needle
their
issue.
dogs. Yeah, the needle issue.
Okay.
Yep.
Because in the past, we were able to coordinate like a team effort, which involved sanitation, health, homeless services, breaking ground, the assemblyman's office, because it was state DOT property that's managed by city DOT with the assistance of the city Department of Sanitation, and teams would go out there. But
So can I tell you what has happened in the last couple of months?
sure.
Breaking Ground drives up to them, right? The Breaking Ground that they take up parking spots for the community. They drive up to them. There's no real attempt to help them. And that's the issue here. These are people that need help. Breaking Ground is collecting their money. They're really not helping them. They may help them once in a while, but it's the same people that are out there that need the help, and they're not getting it. And there's no real attempt. Now, the cops can't do anything, and they shouldn't be the ones that are being brought into this. But I'm worried about the people that are living under the highway. But I'm also worried about the people that are, just walking, the people that live in the neighborhood, or the kids that are going to school, right? Eventually, schools will reopen, and we're going to be at full capacity again. But then you have all this extra garbage. And DSNY, in recent months, has not been doing regular pickups because of the alternate side being suspended, which is understandable. But
What alternate side? What? Well, now it's not suspended. People are
now
getting
it's not.
tickets under there.
But it's all right.
Because they sure do
but-
call in when they get a ticket under there. Wow.
So we've called, and I've called in, but it is, I'm just concerned that people are not getting the help that they need. I don't know if anyone from Breaking Ground is here. And we just need help under there. Everyone just needs, right now, they need help. They need a lot of help.
All right. Well, Yuri,
That's it.
Yuri, you're here.
Hi, Tom. Hi, guys. Can you hear me?
Hi, Yuri. How are you? Now,
I'm
Yuri,
good.
in the old days, like I said, the precinct would say something magical that we're going to be over there with the patrol cars. Community affairs would know who to get there, and everybody would show up, and we'd all do some group thing, and it would happen. The precinct isn't involved anymore. So, how do we get all these players? And how do we get? I've had trouble with. I can't say that Gio's experience is any different than the experience that many of us have had with Breaking Ground. Many times I've gone over to when the men's assessment center was open and they had beds over there, and they'd be like, "We don't get anybody from Breaking Ground." So I get it that people have to accept services, but how effective is Breaking Ground?
So Breaking Ground is definitely out there. They're aware of the encampments. As a matter of fact, last week a cleanup happened and the needle crew was out there, right? That's at Humboldt and Meeker. A cleanup happened. As long as you let me know, you send me an email. Cleanups are still coordinated. The homeless service unit is still in operation. We still work closely with DSNY. Breaking Ground goes out there. At the end of the day, it's up to folks to accept the help. It takes a lot of touches for someone to decide to get off the street.
All right, Billy. You refer to a homeless service unit. That's
the division. Yeah, that's actually me. So DSS is the umbrella, and DHS is under that umbrella.
So when Gio sent his concerns to Ben in Steve's office, did he contact you and then you threw something together, or did that
I would send it to the powers that be,
No,
and they
no,
yeah.
the question was a past tense. Did it happen that way? Did Ben call you and then you?
Yes, that's how it happens.
Okay, well, I'm trying to get clear because the whole committee in here that when we see a particular spot, we're then going to call you.
Email me, sure.
Okay. All right. That's what we have to. That's what we have to figure. That's what we're trying to get is how do we
Yeah, yeah.
respond? Okay. 'Cause
Totally.
I know you have 1,000 cabs you have to deal with, and you're working 65,000 hours a day.
So
So
is there, Tom, can I ask a question then?
yeah.
So is there like Captain Fahey got on and she said, these are the numbers, this is what's happening. Does Breaking Ground or whatever the umbrella organization is, do they have data to say, okay, we did X amount of touches for X amount of people. We moved X amount of people from the street to transitional. We did X amount of cleanups on this road. Like, how can we measure what's happening?
There is data. I will find out. So you're asking for the data, like of the community board? You're asking if that is public?
I'm saying to you that I would like for you're representing Breaking Ground, correct?
No. I represent the Department of Social Services.
Okay, so as the Department of Social Services, a city agency that I'm assuming contracts out to Breaking Ground?
Breaking Ground is a service provider for us.
Right, so Breaking Ground receives city dollars to do this work. So
Yes.
I'm asking, I would like a report that says Breaking Ground or Department of Social Services or whoever it is that you're contracting in this neighborhood received X amount of dollars quarterly, and this is what they accomplished. We need to, if we're really serious about how we think about public safety, and we are reducing the role of police, as Captain Fahey said that City Council has just approved, we need to have a mechanism of accountability. So that could be the Public Safety Committee. So who on your team, how many staffers from Breaking Ground or DSS are outside doing this work? How many touches are they doing? What is the mechanism to measure touches to people on the ground to transitional to full-time housing? We need a sense of accountability. There's government dollars flowing from you to Breaking Ground, and we don't see a change. There's no perception in the work happening. So perhaps you could prepare a monthly report for us to review to see that change is happening.
I will take this back, Dana. I'll take this back. I'll get back to you on the requested information. What I can say now is that Breaking Ground informed me that at least 3 individuals were moved to the new stabilization bed program that they have in Williamsburg.
That's wonderful. That's great.
Yes.
And we know it takes a lot of work to get people who live on the margins into programming, but it just, for those of us who live here, it doesn't feel, we're not visually seeing any of that work being done.
Yuri, if the committee of the board of this committee drafted a letter regarding measurables on homeless outreach in Community Board 1, who would we send it to so that they would then send to you, Yuri, get this taken care of? So it's like you're not going back and asking for it.
I will let my bosses know that you guys are asking for it. I'll let you know what the answer is.
Well, who's what you said? It's the division of the Homeless Services Division. Who's in charge?
Who's in charge of DHS? Commissioner
Steve Banks.
No, I know Steve Banks, but the Homeless Services Division. You're like one person in the Homeless Services Division.
Yeah, I work with the community boards and the electeds. I'm the intermediary.
Right, but who's the guy or woman in charge of the Homeless Services Division?
There's many assistant commissioners, deputy commissioners, there's many players.
Right,
There's no
there's
one
got to be
person.
one who's in charge of the Homeless Services Division, I would think. Well, how do you coordinate your services? Steve Banks can't handle all of it. There's got to be somebody who's over street outreach programs.
I send it to my program administrator and as well as other folks in the department. We have a joint command center.
So we should write to Steve Banks and then he can send it down to whoever it's going to be.
Write it to me, or like I said, I will submit the request, but you can address it to Steve Banks, send it to me, he'll get the request. Sure.
All right. Now, the men's assessment center and the facility on Clay Street, those are still closed and the people are in hotels?
Yes, folks are in hotels.
Is there any planning going on around that, or we're just waiting to see if we get the numbers down?
Oh, wow. It doesn't seem like we're close to like moving back to congregate settings. We're still in the
Okay.
midst of this pandemic. So,
Okay.
yeah.
Committee, go. Questions? Gio?
All I have to say is I've been trying for like years to get these people help. They need the help. I'll keep reporting what I see. My only goal here is to make sure that they get the help and no one gets hurt from the needles or whatever else is underneath that highway. That's all.
Got it. Anybody else?
Tom, I have a question.
Yes. Marie?
When does it kick in that people who are homeless have to be removed from the street because of the weather?
Oh, the blue.
Yeah,
Code
we're not
Blue.
quite at Code Blue season as yet. I have new information that I will forward to you all.
Okay.
Thank you.
Yeah, send us the Code Blue information. We got information about the stabilization bed program, right, Marie? Right? Marie?
Are you talking to me?
Yes, we got, and they sent information to the board about this, the new stabilization beds. Did they?
I haven't read it yet. I'm sorry.
Did it go out to all of us? I don't remember.
I'll have to check because it doesn't ring a bell.
Okay, Yuri, can you send us like a blurb about something about the new beds in Williamsburg again?
Sure. And did you invite Casey Burke to today's meeting?
I don't see her. No.
You should. So for future meetings, please invite her. They are on the
I have
ground.
her
doing
email
work.
like in 100 places. I don't know that she's the easiest person to get to anything.
Yeah, and just like you can CC me, I'll make sure that she attends.
But there needs to be some overarching control place, since we're, reducing the funding for social services that the police department used to get stuck doing, which wasn't a police function, and moving it somewhere. Somebody should be in charge of, okay, somebody calls in and said there's this thing happening, people need assistance, there seems to be a lot of needles, and then somebody says, okay, team, go. And I don't know that the person who's the cab person with 65 different shelters to deal with is the person who throws that all together. So,
So I don't.
you
Yeah.
don't call the borough director of sanitation and say show up, do you?
No, I don't. But as
Who
I
does
said
that?
before, I send it to the DHS program administrator and the folks that schedule the cleanup, and they take it from there.
Okay, well, that's the mysterious person.
I ring the alarm pretty much.
Excuse me, Judy, I have
Go
a
ahead.
question.
Go.
Do you know who is the person in charge of community relations at DHS?
Community relations at DHS?
Correct.
There's no one person. I am the point of contact for the Borough of Brooklyn. So I'm your contact for any DHS matters.
Okay, understood.
Okay.
I get it. All right. So, any other questions right now? Marie, yes.
I do.
Who's that? Whose voice is
Lisa.
that? Lisa, go.
Okay. So a lot of the individuals, and I agree with Gio because I walk under the BQE through Meeker Avenue, the Meeker Avenue BQE every day. So whether my sister lives on North 6th, off Meeker, and she also has major concerns, having 2 small children with the needles. So it's not only in that area. What they do is they kind of move around and they drift, down North 4th, North 6th Street, and you know, she finds needles outside her house all the time. And then the other thing is like, I know that there are people out there that provide service, but if these individuals do not want help, so what do we do as a community to keep everyone else safe if they're not wanting to go into these other services? You know what I'm saying? And now that the winter's coming, you know, if the shelters aren't open, what do we do? What do we do as a community? You have a lot of people there reaching out, so they say. But what do we do for these people if they don't want to get the help themselves to keep our community safe?
A challenge.
You know, so.
All right. We have to figure out somehow how to get a meeting just about this with the right people in the room. So I don't know.
I mean, Tom, you say you haven't left the house, but if you go along Meeker Avenue, whether it be North 6th Street, whether it be.
At least I know where it is. It's been going
Yeah.
on for a long time.
Yeah.
But before March, when we could get it, we would just call the precinct and we'd magically get a team together and would take care of it. But
I mean,
once that change was made, it got to be like, who's in charge? Nobody.
Yeah. Manhattan and Meeker is bad too.
You know.
Needles everywhere.
And so we somehow have to, I don't know, I guess we're going to have to write to Steve Banks and maybe our council members and say, okay, this is our issue. We need to put together the appropriate people in the room, and somebody has to be in charge of what we used to be able to, you know, voice that we said we didn't want the police department to be doing a lot of things that they're not trained to do. And we reduced their budget. But then what did we do with that money we reduced their budget with? To provide the outreach services that we need to address some of the quality of life issues. So we got to figure out how to do that, right?
Yes.
Am I off the wall on this?
No, I agree.
I mean, I don't want to, you know, I always think about there's all these other service providers in the borough of Brooklyn. The borough president talks about the shower van driving around. I don't know if you've ever seen that here. Is there ever any food brought over there? I mean, those people have needs. And then there's the other thing about making the folk who fled COVID somewhat responsible to stop dragging their couches over there. You know, the whole issue of dumping. What's sanitation doing about that? You know, I know one guy was sleeping on a stack of 7 mattresses. I mean, you know, that was pretty wild. And DOHMH used to go out and do the needle pickup because it was too dangerous for anybody else to do it. Maybe there should be a regularly scheduled needle cleanup. New York never did needle exchange, but I don't know. So we have to figure that out.
The first step to me, Tom, is to figure out a mechanism for accountability. Let's actually figure out if outreach and work is being done regularly, and then there's going to be a next step. If it is and that's not working, then what do we have to do?
Right.
But before we try to figure out innovative solutions, let's see if the people getting paid to do the job are actually doing the job.
Right. We need the measurables. You know, like you're paying somebody to do X. What are they showing that they're doing? And because I mean that's been an issue. I've been on the Men's Assessment Center CAB, and the community over there keeps asking numbers about, you know, yes, there's so many beds were being held there for people that Breaking Ground did intervention with, but we never had any information from Breaking Ground saying, well, how many people did they have intervention with? Who did they talk to when? And there's even one woman who used to show up, and I did not approve of her methods, but she showed up and said she'd have a friend go out and lie on the ground and pretend to be homeless, and she'd call Breaking Ground to see how many hours it took for them to show up. So I don't think we should be doing that, but yes. Well, if you, Gio, if you have some paragraphs you can throw together, and Dana, you can throw some language about measurables or whatever those words are that we do. I think maybe a letter from the community board to the commissioner of, Steve Banks, should be a start. You know, Gio, Dana,
Sure.
give me some ideas to throw together, and then Marie and I can work on something, and then I can poll everybody and see if that works for you.
Yeah, that's fine.
Anybody else on the committee have any thoughts? All quiet? All right, now, that's my agenda. There was an issue about senior centers, but I think that's the Department of
DIFTA.
that's DIFTA.
The
I don't really,
Tom, Mr. Detective Eusebi is still in the.
oh, he is? Where?
He was.
He
I didn't
is.
see him. I'm always looking at oh, there he is, right in the middle. Oh, sorry. I didn't realize you were there. Forgive me. Sir, would you like to tell us what's happening on PSA 3? Where is he? He's there. I see him. His microphone's off.
There he is.
There he is. Sorry, I didn't realize you were there. Forgive me.
No, that's all right.
So what's happening in PSA 3 land? Anything related to all the things we just discussed?
Well, we most recently we had a male shot at 60 Moore, a 28-year-old male. During the month of October, we took shots fired at 181 Stag, which is Williamsburg, and on October 9th, we took another shots fired in the rear of 130 Humboldt and 155 Siegel. The male shot is, we suspect gang violence. Anything further than that, everything's still under investigation. But we do have a fixed post at 166 Ten Eyck Walk and at 155 Siegel Street as a precautionary measure.
This is Williamsburg houses?
Yes. Yes. And then in the land of community affairs, we're collaborating with the Bushwick Resident Association president to do a coat drive for the wintertime. So if you know anybody that would like to donate some gently used clothes, we're in business for accepting them. And we're also working with the Assemblymember Davila's office to do a turkey drive again this year. We don't have a specific date as far as when we're doing that, but that's in the works. And we're also doing a Toys for Tots. I think we ordered about 1,000 toys, so we'll see how many we get. That's what we ordered about last year, and it went by pretty quick. So it seems like a lot, but it's really not.
Do you have a flyer for the coat drive?
No, not yet. So all these things that I'm mentioning to you, those are things that we're currently working on. We're trying to get. We're trying to find. We have spaces in mind. Where the dates are going to become a little bit more concrete within the next week or so.
Okay.
So as soon as I get the flyers for all those events, the coat drive, the turkey giveaway, and the Toys for Tots, which I probably will send that out starting at the beginning of December. I'll make sure that the community board gets it.
Okay, because the community board meetings, the full ones are November 10th and December the 8th. So if you get it like before that, then we can let we send a lot of stuff out to board members before those meetings. So one is December 10th, the other is November 10th, the other one is December 8th. So,
December 8th, got it. Okay.
So if you have stuff, you get the first week of a month, then we can distribute it to the full board.
Yeah, no, that'd be great. That would be awesome. Last year we did the Toys for Tots. We did we filled up the muster room here with toys, and we decorated the whole room with a Christmas tree. It was beautiful, and I wish we could have done the same thing for this year. But last year the muster room was packed with kids, and obviously
that's not going to work
this year. Right, it's not going to work. So we're going to have to find a different strategy, maybe I don't know. I'm sure we'll come up with something. But
All right.
either way, we put a request in for 1,000 toys.
Williamsburg houses.
Tom, can I ask
Wait,
a
wait, wait,
question?
wait. The Williamsburg houses with the shots fired situation on Stag and the other street. You said you got a post there now. Are you working with the tenants association and the community there?
When things like that happen, my partner and I, and along with the NCOs, we go out and we do some outreach. We try to speak to residents, try to get some intel. We do work very, very closely with the Williamsburg Resident Association. We have a great relationship with them. It's tough. It's tough getting some info. People are afraid, you know.
But you've got the Williamsburg Community Center there. And is that the Grant Street Settlement is operating that now? Are they doing outreach to the young people? Or do they have services for anybody that's been impacted by anything that's going on over there? Are they doing, because we have services from Los Suris in Bushwick houses and in can't think of the name of the other one.
Los Suris and Grant Street in Bushwick houses.
Right, but so is anybody doing the same thing in Williamsburg houses, like reaching out to the young people there? Do we need to push the city to get more services? I don't know.
Well, I know the Williamsburg Community Center has a very, very strong programming. I don't know if they're creating programs geared specifically for the gun violence, but I can tell you that they're very active, as is Bushwick. Bushwick, we have a great relationship with them as well. They're always partnering up with us. In fact, we had a shoot hoops, not guns, a couple of months ago in the Bushwick houses. We had the rock wall up there. We had a lot of kids come out and shoot hoops. We had a 3-point contest. It was fun. And so we're trying to constantly do things like that, trying to engage the youth. I'll be honest with you, it's very hard to engage the youth, but we're doing the best we can.
Because you have 11 complexes in Ward 1, or how many?
So we have Independence houses, Williams Plaza, Berry, down on the other side.
Williams.
Right, and then we have Bushwick, Williamsburg, Borinquen houses.
Highland.
Yes.
Do you have Caribe Gardens?
No.
Okay. Now the other thing
Sorry.
before we get to Dana, the early voting location for us is the Williamsburg Community Center, right there in the heart of Williamsburg.
Right.
So are you coordinating with the 9-0 and the community or whatever to make sure that things are going to be under control?
Absolutely. Every time there's a voting location, we confer with the precinct, and we have personnel there, and we're on top of it, and we have a sector card that patrols there regularly just to check in on things. So we do have that covered, and we are aware of all the locations. We have a list of locations, and we're visiting them.
Right, but that's the regular.
Yeah, I know.
But the early voting starts next Saturday
Right.
for a week, so it's kind of going to be everybody it's like all the other voting locations are all going there for their early voting. So
Well, I can tell you, it's for the next 2-3 weeks. It's going to be all hands on deck. So there'll be coverage there.
all right, Dana.
Yeah, I was just curious, Detective, about, talk a lot about the toy drive and this, as far as public safety goes, the shooting is critical. That's the number one thing as far as, and along with any other incidents that you might be experiencing an uptick in. And so I want to know, how are we leveraging organizations that are community partners to do toy drives or turkey giveaways or whatever to become crime reduction partners? So how are we having conversations with community partners to bring them into conversations around the gun violence, not just about getting intel, because we know that naturally that's organically, we're not there yet.
Right.
In reimagining locations and spaces and really doing that. I'm not saying the police department should do that outreach, but are we talking to Grant Street Settlement and saying, hey, this is a group of kids that they're on our radar. We need you to specifically tackle doing outreach to these kids, right? Or this is a block that we're seeing, consistent quality of life issues on, we need you to specifically target this block. Like, can we use the intel that you have, give that to community partners, and then activate them to use the resources that they have and the talents they have and the connection with the community that they have to actually help mitigate some of this stuff and maybe even make it go away?
Oh, 100%. So we changed things up a little bit in our events. We always try to engage the youth, but how should I say, we expected them to be attracted to the events once they were outside and they saw what was happening. But what you bring up a good point, Dana, is that we are recruiting these community organizations, and these community organizations are on site, and they are sort of kind of branching away from the event, attracting the youth into the event, as opposed to just waiting and seeing if they're comfortable coming to see us. A lot of the times, the youth will admit that they don't want to be seen with a strong police event. That is one of the major challenges. We had a Farragut cleanup 2 weekends ago. We had some youth out there, helping us clean, and it was great. But I wish we would have had more. So anybody that has any ideas on attracting more youth, I'm all ears. But we are working strongly with community-based organizations, and we are, for lack of better words, targeting kids that need more attention away from the bad influence. Does that make sense? Did I answer the question?
Yeah, totally. And I appreciate that answer. I'm just saying it would be helpful if you as the precinct shared that information with the partners, saying this is habitually we see robberies happening here. These are kids that hang out on this block, on these benches, these are the kids, and then have them do outreach without you, right? Like, because we know that they don't feel comfortable around a police presence. Like, how do we really manage up to the organization, similar to what I'm saying about DSS and
Right.
Breaking Ground? How do we manage up to them and say, we're giving you intel. The intel is that this group of kids who hang out on this bench, we have our eye on them because we think that they're committing robberies. We need you as Grand Street Settlement, or you as Los Soras, or whoever your community partners are, to do outreach to these specific kids before we have to get involved, right? So the onus, it really isn't on you, it's on your community partner.
Right.
No, 100%.
Dana, we need to identify the community partners and go meet with them, I think, too.
I've been working on it.
There's so much going on. It's like, and then you got DYCD funded programs, and how do you get DYCD to even do measurables? I mean, they're book.
How do you get them to even open? How do you even get them to open up a facility and be where they're supposed to be? So,
But that's the thing. I don't want to end up having 20, 30 cops handing out toys, right? That's not what I'm looking to do. What I'm looking to do is having a couple of cops with youth in the community weaved in. That I don't want to see 30 cops just handing toys to the community, because that's kind of counterintuitive to what we want to do.
When the Three Kings at Grand Street campus happens, and the Three Kings parade, you work, because they have a whole event where all the kids show up for the Three Kings party. Rob Solano and Antonio and all that kind of stuff.
but Tom, those kids aren't your shooters. Like,
yeah,
I know, but those programs are in that neighborhood. What other, and Grand Street Settlement, we got to find out what they're doing.
So our community centers are great partners. They really are. They're wonderful, and there are troubled kids in those community centers. Last year, and I wish we could have done it this year, I had an apple picking event upstate, and it was incredible. I took kids from out of their element, and they were up there picking apples, and we had a great time. We were talking to one another. We felt comfortable around one another. We went through the corn maze together. We tried to solve problems together. Those are events that are really awesome. And unfortunately, COVID put a damper on that, but we'll do it again, hopefully next year. But things like that do work. Things like that are a huge success. So the community centers do their share, and they really are very good with us. They are very responsive with us.
Okay. All right. Anybody else on the committee have anything for Detective?
Oh, one other thing, our community council meeting, we resumed this month, but we had to postpone it, but we're probably going to have it on the last week, and we will resume monthly meetings.
Are you going virtual or live?
Huh?
Virtual or live?
Sorry, virtual.
Okay.
So this month is an exception, but starting in November, it'll be the first Wednesday of every month, as it has always been.
Yeah. Which, as you know, is also the 9/4s. So.
Yes. We also been making our residents aware of COVID scams. So contact tracers are, you have people posing as contact tracers asking for personal information, financial information. Contact tracers will not ask you for that. They'll ask you for health-related questions. And you'll also have people calling you saying that they have vaccines and they have treatments, selling products that treat or prevent COVID, which obviously, that has not been discovered yet. So be aware of that. And also, people are calling so they can be put on a priority list to receive the COVID vaccine. Those are all scams, obviously, but we're going to pass that information along to our residents.
Okay. Thank you, sir.
Thank you very much. Thank you. Dana, thank you.
I have one question. Jeremy, is it possible for you to forward me? I work for Woodhull Hospital.
Okay.
And I didn't hear about what what you just mentioned right now about the tracers.
Okay.
And what's happening. It's important. I would like to share that as well with with the board here and with the hospital, with the staff.
Okay.
That'd be great. Yes.
No problem. I can give you my contact information. We can maybe link up at some point if you'd like.
Yes.
Or, yeah.
Yes. Can I give you my email really quickly?
Sure. Go ahead, please.
It's AROCHOJ@nychhc.org.
.org. Okay. Okay, got it. I'll email you as soon as we're done, and we can link up. That would be great. Thank you.
All right. Committee, we need to get a draft letter to go to the commissioner about a whole homeless team thing. If people could work with me on that and with Marie. Also,
hey, Tom. Yeah, I just figured it out. You can address the letter to Administrator Jocelyn Carter.
Spell that.
JOSLYN Carter.
Okay. And she's the administrator of what?
At DHS.
Okay.
Yep.
All right. So Dana, Gio, Marie, and I can work together on that. Then we had only set 4 meetings for the year, but do we want to set a date for the next meeting, and then Marie can see if she can get it in the calendar somewhere, folks?
Yes. Go ahead. Pick up the day.
Who's speaking?
Agree.
Agreed.
So,
Agree.
all right. What day of the week? What is today? Today's a Monday. So, and it's October. Where are we? The 19th. So, there's Thanksgiving in November. We want to do a month, and then in the next month it's Christmas. So, but neither holiday's on a Monday. Do we want to try? Maybe we can get somebody to some kind of thing to discuss by the 30th of November. I don't know.
What date of the week is that?
It's a Monday. I don't know if Monday is a good day or not. I don't know. I was using Tuesdays in the past. We were working on Tuesdays in the past, but
I think
That's because I was at the Woodhull Cab and those Mondays is when they have.
Okay,
hearings,
well,
remember?
we can go to Tuesday, but in November, the 10th, the 3rd is election day. The 10th is the community board. The 24th is supposed to be the SLA if we ever figure out what we're supposed to be doing. So we could meet on the 17th maybe if Marie has a date open. I don't know. Or we can do December 1st.
December 1st, what is the date of the week?
That's a Tuesday.
Tuesday is no good, Bogdan, because we have a
No
meeting.
good, no good. Wednesday, make it Wednesday. 2nd, December 2nd. Wednesday, Tuesday.
The Wednesdays are always precinct council meetings. The 9-4 meets and the PSA 3 meets that night. So if you want the police to be there, they're going to have their own meetings.
I think
So-
executive board also meets on that first Wednesday, maybe. I don't know, Marie can.
December 1st, the Polish president's meeting?
Yes.
Oh, how about Monday? How about we stay with Monday?
Which Monday is the
That would be November 30th.
but Maria, which day is the hospital's Monday?
Is Jessica still on? I think it's the last Monday, or sometimes it's the Monday. I'm not sure because I'm not there anymore.
Oh, wait. She just told me. The next one is 10/26.
That's not a month. 10/26.
That's the last Monday. That's the last Monday of the
yes.
month. So
It's
the
usually
last
the last
Monday.
Mhm.
Well, for crazy people, we could do the 23rd, but will we have something thrown together that week? Or the 7th?
Tom,
Labor Day or the 23rd?
Tom, can you make it December 3rd? That is Thursday.
I can make it December 3rd. I don't know about anybody else.
Okay.
I gotta ask Marie.
Whoa, rocking out. Marie?
Right now, I don't have anything. You
On
talking
December
December
3rd?
3rd, Thursday?
Yeah.
Okay.
Okay.
All right.
December 3rd.
Yes.
Okay. And then I want people to tell me who they want there and what we're going to talk about, but like quickly, so Marie and I can get the word out. All right. I have a hard time keeping on top of all this.
DHS, Tom.
We got to do that letter. Dana and Gio, let's get that letter done this week, and then we'll invite them to come on the 3rd. And breaking ground,
Sounds good.
you know?
Yep, sounds good.
Sounds good.
All right. Got it. Good. And Marie, you're taping this. Yay. Because I can't write that fast. All right. So December 3rd is our next meeting. You got to get a letter to DHS about the team cleanup stuff. And then anything else you think should be brought up, breaking ground, DHS. The election will be over by then, so some of us may no longer be in this country. Who knows? Right.
There's a question here, Tom.
Yes,
Good
where?
evening, all. I have a long question for the committee. Jordan Epstein, that won't fit in Q&A. At the board meeting last week, the BQE Wythe Kent exit was mentioned. The tragic loss of Sarah Pitts only serves to emphasize how critical and paths to improve infrastructure at this exit is. There were mentions of increasing NYPD traffic enforcement at that area. And frankly,
Where are
given
you reading this?
the chat.
Oh,
And
you're in the
frankly-
chat now because I'm in question and answer. Oh my
No,
God.
he
It's like-
said this was too long for the question, for the Q&A.
oh my God. All right.
So there were mentions of increasing NYPD traffic enforcement at that area. And frankly, given what Sarah was fighting for, that was a slap in the face. We cannot skirt around the challenges of designing safer infrastructure. How will the Public Safety Committee work with the Transportation Committee to ensure that non-police long-term solution is implemented?
We're talking about the Williamsburg Street exit.
The BQE White Kent exit.
Yeah.
That's a big one. That's a big one. And we've been talking about this for a while now.
Yeah. And I cannot publicly state what my position is on that because I'd be thrown off the community board. If you can figure out how to deal with that corner, somebody tell me. But we've been millions of meetings about
That
that.
needs to, Tom,
Yeah.
we could easily tell, the question is, the problem is, there needs to be political will to allow the community board and DOT to deal with that corner.
Correct.
And until there is political will, nothing will change.
Correct.
So the real people to be putting pressure on, if you're organizing around this issue,
It's a council member.
is your council member, the council member for that district, the borough president,
Yep.
and the mayor,
Yep.
who allow this problem to persist because
Right.
they do not have the political will or courage to take care of it.
And that would answer the question that Sharon asked in the question and answer about who's represented. Because there has to be a political will to have representation of everybody in the community board area. And put some young people on the committees and community board, but that was a promise made 8 years ago, and we don't have any youth on our community board. So it's really the council member and the borough president that need to take a stronger position on that. We have millions of meetings about that intersection until we get the political support to fix it. DOT has come in with proposals and they get shot down all the time. So
I'm really behind on reading the Qs and As, but I auto-nominated myself to be reading the Qs and As. Jordan Epstein said, thank you, I'll keep pushing on representatives, but we wanted to make sure that we don't just default to PD enforcement and abandon the issue.
right.
Thank you, Jordan.
We're, you will notice that this committee has got like everything at the community board that nobody else wants to deal with. And so we're trying to keep it going. But if we can get some more people on the community board that are working in some of these areas, we might, Maria goes to all these hospital meetings and she's running herself ragged. Oh.
So Taryn Addison said the way to attract more youth is to have more people who look like them. I don't know what that means, you guys.
I just did that speech. We needed to have a more diverse community board, and that requires our elected officials to be taking a political position to diversify the community board.
It says, how are you speaking about Black and brown children without a representative there for them?
I hear you. I definitely hear you. And once we get through November 3rd, we're going into a city council race and a borough president's race. And those questions should be raised with those people that are running for those offices about what they're going to do about community board appointments. Not for us to do.
I thought that we were term limited. What happened with that?
I don't know.
I'm serious. I'm not even joking. This is
I don't know. I know. It's supposed to be 2 terms on, 1 term off, all that kind of stuff. I don't know what happened to that. I don't know when it goes into effect. I have no idea.
But quite honestly, as somebody who spends every single day talking to young people who live in housing, not on the phone, not forums, the other day I had lunch on Thafford and Picken in Howard houses, talking to young people about the issues that are there. They're not going to participate in community boards and things like this until their basic needs are met and until they feel like something productive is going to come out of this, other than hearing them talk about what the problems are, which we all know what the problems are.
Right.
And it's about political will to solve those problems. So quite honestly, it would be a stretch to get the young people that are not your honor roll students, but the kids that are suffering the most by what's happening socially with gun violence and COVID-19 to even participate, because they're surviving day to day.
Preach.
Got it. All right, so let's get that letter going. We have a meeting, what did we say, December 3rd?
Yes.
And get me any ideas and people that we need to have there, all right? So everybody stay safe. Thank you very much. Anything else from anyone?
No.
Going once, going twice? Go eat dinner?
All right.
Bye.
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 Good night.
Bye, Tom. Thank you.